You are a seasoned physician. What else are you?
I am a father, a husband, a sportsman, a good friend, a man of principles, and I love life.
When did you discover your passion for medicine?
I guess in late adolescence, at the end of my school years, I loved biology, I loved science, and as a human person, I liked helping people and problem solving. I could see myself as a doctor.
Describe your work philosophy.
I really take what I do very seriously, but I don't take myself too seriously. One of maybe the best compliments I've had from a patient is, "Doctor, you're an artist, but I love how you work with honor." And that's how I like to see myself. I hope this will be my legacy. I like to think that every patient is an ambassador. I don't take anybody for granted. And every treatment is a signature. And I think that's part of me being a perfectionist, part of me wanting to do the best that I can and help people as much as I can.
Describe your style in aesthetic dermatology.
I think if I were to choose a keyword, it would be restoration. And because of my years of study of skin and mastering all the aspects of dermatological treatments, injections, laser, and surgery, I'm able to turn back the clock and allow my patients to look very natural and useful and rested. This is what most people really want. And this is frankly what I'm really known for. It is much better to do a combination of small treatments than to do a lot of a single treatment. One saying that I really avoid is, if all you have is a hammer, everything looks like a nail. And that's pretty much what we see in a lot of the commercial work that is around.
What is the greatest misconception in aesthetic dermatology today?
I think that it takes really lots of years and lots of study to be in full command of what we do. The greatest myth is that you can watch a video and learn the procedure and do it, and unfortunately a lot of this is going on around the world. It takes a lot of study, a lot of practice, a lot of understanding, a lot of psychology, a great eye, a very skilled hand to achieve what people want us to do safely, effectively, expertly, and to make sure that it is done really in the proper way.
The work is exhausting. What keeps you going?
Definitely my passion for my work, my love for my patients. I'm really grateful that I have taken care of some patients for 25 years. All of my career, from Boston to Beirut and around, I've been able to carry those patients around and take care of them and watch them grow, get married, have their babies, and age very nicely.
What is the most rewarding part of your work?
Being able to make people happy by making them look their best. This is really empowering. It's a confidence builder. There's nothing like looking in the mirror and seeing your own face, despite the age, despite the stress or the times, seeing a rested face, a face that looks like yourself. It is really extremely rewarding to have a role in this. The trust that people have in me is extremely motivating, and it really gives me that energy to come to work every day. One of the nicest feedbacks I had from a patient was that after 15 years of regularly coming to the clinic and getting my work done, she really feels like she hasn't aged. She not only feels more as beautiful as she has always been, but she feels more feminine. And that's, I think, so important. Another part of my practice that is extremely rewarding is taking care of skin cancer patients. Those patients come into the clinic anxious, stressed, confused. Being able to diagnose them, reassure them, and cure them, whether with a medical treatment, a laser, or more commonly surgery, makes me very happy and makes them very happy and very grateful. And I'm really fortunate to have that skill to be able to participate in the care of those skin cancer patients.
Can you share with us your favorite quote?
You know, practice makes perfect. And one of the things I like to tell my patients is that a procedure that might take me a few minutes is actually the result of 20